Medical assistants play an integral part in performing administrative and clinical tasks that supports the work of physicians and other healthcare professionals. The medical assisting program includes administrative and clinical competencies expected for entry-level positions in a healthcare setting. Students develop skills in front office administration with an introduction to health insurance and basic billing practices. The back office portion focuses on direct patient contact and typical clinical and laboratory skills such as minor clinical procedures, EKG, phlebotomy injections, and lab screenings. Students also learn to observe universal precautions, OSHA regulations, HIPAA requirements, confidentiality, and the legal aspects applicable to any allied health environment. This is the lab, the medical assisting lab of Fortis College. And I'm going to introduce you to the program director for medical assisting to walk you through the lab. Regina?
Hi. All right. So what we have right here is our phlebotomy station. This is where the students learn how to do venipunctures, also known as phlebotomy. Inside the drawer, we do have some capillary puncture needles, and then they just have a nice little station right here where they can grab their supplies. Also over here, we have where they can get weight, both the standard method that's used in clinical hospitals, or some hospitals now are using an electronic method. We also have a arm that they can practice the phlebotomy on before they do actual live sticks. And then they have their gloves. We have a mail stand in which they can set up to put their supplies on there when they're doing either a procedure or if they are doing a phlebotomy stick. Also over here, we have an EKG machine, and this is where the students, they can look up on the wall and they can see where they can place their EKG placements. We do have a curtain that will give privacy, and we do have hospital gowns that we have the students put on, and they still keep on a sufficient amount of clothing underneath so that they are not totally exposed. One of our newest machines here that we have is our electronic blood pressure machine. It also gets a pulse ox, which is what is pretty much used now in clinics. Some clinics still use the old-fashioned method, so we still train the students with a sphygmomanometer. So, and these all have drawers that come out, and of course they have that we don't use these, we just show the students how they're used. This is where the instructor sits, and the students sit here. We also have 2 autoclave machines, and then this is just like where we have some of our bandaging equipment for if they're gonna learn bandaging. So we have a select amount of those. We also have, for the autoclave, sterilization equipment so that they can use that. We have a bunch of instruments that the students will use, and they will end up putting inside of either muslin, or they will use one of these sterilization packs to put them in. We do have a couple microscopes that they'll use if they're gonna do any blood draws and put a blood stain on there. We have a drawer full of supplies so they can learn how to do suture removal. And we also have pap supplies, so they learn how to assist the doctor for pap smears. Other things that we have thermometers. We have a couple styles, this being the most popular that's used in most clinics, which is a Welch Allen. But we also have, and it's oral or axillary. And then we also have a thermometer that is temporal. This is the one that is usually used across the forehead, and they use those majority in infant places, or infants, I'm sorry, pediatrics. And then this is a not axillary, a temporal one as well. And we do have another thermometer right here that is for the ear. We have injection models up there, and so the students, if they're a little nervous of doing injections on each other, they can practice on those first. We have tons of syringes, so we just have lots of syringes for the students to use when they're going to get to doing injections, more syringes. We have all of the probe covers for our ear stuff. And then also we have some materials down here that the students are using for pipettes for when they're doing urine specimens. Here are some specimen bags. These are also used for doing capillary punctures, which is a part of blood collection. Here we have our CLIA wave testing, which stands for Clinical Laboratory Improvement Act from 1988. So they have all of the stuff to do strep tests, they have stuff to do urinalysis as well, hemocolt kits. These are very important that the students learn these when they get out in the field. We also have urinary supplies and a lot of testing for them to do urinary procedures. Also, I didn't show this. We have eye wash stations, so in case there's a hazard, the students can learn how to use the eye wash station, which is pretty cool. We also have two, this is a centrifuge, one for hematocrit, which is what I just showed you, these pipettes right here. And then we have a regular centrifuge that is for tubes where they can spin the blood. And of course, we have our material standards data sheets. We also have these little gadgets here to put tubes in, so once the blood is spun, they can see what it looks like. Inside of here, we have, this is our inventory room. So we have a lot of inventory, which is pretty cool. Lots of tubes, lots of needles. This is mainly all of our blood collection stuff on this side, and on this side we have what I would consider dry stuff. We have our gloves, we have gauze, we have Band-Aids, we do have alcohol, which is not dry, but usually you have alcohol pads, but now we're using liquid due to the pandemic. We just have the liquid there, and then we have some gloves. As well, we keep our OSHA, our biohazard right here, which will be getting closed pretty soon because it's getting full. And we also have some devices for assisted to help people walk, so we teach the students how to use that. And there you have it for medical assisting.
All right.